For those who don't know, I'm Juan Michael Porter II. I am the new Director of Communications for Positive Women's Network. My pronouns are he, him. And thank you for joining this webinar on the Comms Baddies. Briefly, the Comms Baddies program talks about public health from the perspective of journalism, social media, and in-person speaking engagements. There's an advocacy perspective to it, but more than that, there's let's share information with people by speaking to them in the way that people speak perspective. And if you're like me, I'm sure you've been in places where people use a lot of acronyms or use a lot of jargon that makes sense to them, but not to everyone else. I'm going to quote my colleague Esther Nagazi, explain it to me in the way that you would explain it to my grandmother back in the village. If my grandma back home can understand it, then anyone can understand it. And I think that that is the real gold standard for public health messaging that we've focused on so that it is something that we can take and hold in our hands instead of being left behind by people who weren't thinking about us when they designed that system. Now, I'm going to moderate this panel, but most of it is going to be led by our incredible comms baddies, and I'm happy to introduce them now. We have Bee Velasquez, an Oregon advocate, PWN state lead, PWN policy fellowship graduate, and PWN comms baddie. She brings nearly 30 years of lived experience and a passion for creating meaningful change. Welcome, Bee. LaDawn Tate, a nationally recognized HIV advocate, trainer, speaker, and peer leader, and the Leadership Development and Training Manager at Positive Women's Network USA. I should say the new manager recently joined our team. Welcome, LaDawn. Thank you for being here. And of course, Xeena Ellison, a New Orleans native, disabled Black trans multidisciplinarian artist, organizer, 2026 PWN Policy Fellow graduate. I saw your presentation. It was the bomb. DJ, filmmaker, poet, HIV/AIDS advocate, and I must say, a full bag of chips. Welcome, everyone. I'm so excited for you to be here. And because we have limited time, what we're going to do is have our comms baddies speak about the program for the first 28 minutes, and then we'll have 30 minutes of Q&A. And if we don't have questions after that, we can come back to speaking about the program. But for now, what was your understanding of public health before you joined the program? Each panelist responds to this one, so 2 minutes each. Xeena, why don't you kick us off?
Before I joined the program, I think I thought about public health in a more literal, tangible, physical way, like something that is not necessarily about communicating with the public. And that was one of the things that I think working with you and everyone else really enlightened me and opened me up to is just being able to see how communication, messaging, and talking to the general public can change public health, as opposed to public health just being this building you go to for services or the people that work in the buildings. But public health also can be like the way the activists and organizers reach the public with the messages they have.
I love that. And I want to say that you reinforced that for me quite a lot as well. Thank you. LaDawn, please, what was your understanding of public health before you joined the Comms Baddies?
Just in a nutshell, it was just everything that dealt with health is what it was about to me. Being able to stand up and speak up.
I love that. And it sounds like you had an engagement with it that wasn't just like receiving it, but responding back to it as well. B, what was your understanding of public health before you joined the program?
Before I joined the program, public health to me was public health. I thought it was just like overall health system for the public. I didn't really separate it or think about health messaging as its own thing. And really was what has surprised me was how differently I see messaging now. But I think it's something that I'll probably get into more as we go through the conversation. Thank you.
Thank you. And that actually brings us back around to Xeena. How did your understanding of public health change over the course of the program?
As someone who did creative writing in high school, like I went to an art school here, I've always been very, I think, well aware of like journalism and magazines and literature and just like even going to the clinic. Sorry about that. I I've always been aware that that's existing, but I never thought about it in the way that I think you have brought us to like think about it, which is that it's something that can get some of these messages that aren't reaching the public out in a way that's digestible to them. And just kind of going back to what you said, opening with like explaining it to the grandmother in the village, like you have reinforced that over time, and it's helped me to approach writing from a different angle with like the goal to reach people at their level of understanding. And that really resonated for me as someone who champions for literacy, not just for like Black, LGBTQ, disabled, whatever demographic I fall into, but just for everyone when it comes to health. And I think that's what really solidified the public part about it for me was like, this is to get these messages out to everyone so we're all at the same level of understanding, despite the gaps that exist with literacy in our country and beyond, and just how the information is being pushed out by the medical authorities is something we talked a lot about and dived into, which I really appreciated. And so now I have a different rate of writing that is not necessarily solely about being creative, but is about reaching people where they're at, which gave me like a whole new writing path. So I'm very grateful for that and learning from the people that I worked with as well as you.
Thank you for that. When I was at a different conference, this incredible woman said, meet people where they are, but don't leave them there. And it's been amazing to see you all have those epiphanies of like, all right, I'm not writing this for me. Sometimes I'm writing for me, but sometimes I'm writing for the other person who may not be at that same point. B, now that you've gone through the program, is there a lesson that you would have changed or something that you wish we dug into deeper? Criticize me.
No, I wouldn't change a specific lesson. I came into this program without any expectations. And since I like writing, I was like, oh, maybe something can come out of this. And the idea of submitting an article for publication, I think, is what was like that question mark. And it's also new to me. And so one of the things I would have liked to dig deeper into is the terminology. And I think you just mentioned something like that. I think there's different language used around public health messaging and how those terms are used. But more than changing a lesson, I would have liked more time for us to spend together. I think I think our time together that we had was amazing and is very short, but I would have liked more time. And I will say that you gave us a lot of insight and structure and guidance. And I think having more time as a cohort would have given the space to dig into the things that we were learning and ask more questions and learn from each other.
Thank you for naming that. And I want to name for people who don't know that this was actually a pilot that was put together for the Comms Baddies. And Xeena, Bee, LaDawn were all invited. And because I do believe in our membership and our like actual community, making sure that things are equitable, I was like, I've seen these bad mama jamas out there doing this work. And I feel like I could actually do this pilot with them so that we can roll out the actual program for people to apply afterwards. And if they say that they learned anything from me, I learned just as much from them. When people say like you really know that you know something when you can teach it, they just reminded me like, oh, I do know this, and more than that, they know it too. And so they had 2 months with me. The actual cohort is going to go longer for those who are applying. But now let me get back to the questions, the Q&A, LaDawn. What is the one way that you apply the program's teachings during its run?
We had the opportunity to actually make change. And when I say making change, like this was a big, right? Being able to sit down and have a conversation to let people know what it is that we want, that was something very powerful to me. So being able to actually write, now I like writing, right? I can't stop writing. I rather write than type. But now that it's writing, like being able to write public comments about issues that I feel are important, concerns that I feel are important, be able to actually make a real impact when you're thinking about writing policies or, actually writing to someone that you want to say, hey, let's talk about this. I think this is a story. So being able to understand what it is that I want to focus on and how it's going to impact everyone and not myself, just myself. That is what the biggest lesson that I learned, and I am using that now to the max.
I thank you, and I love that. And I want to add that like I love that you love writing. And for those who don't know, Xena was such a powerful like cheerleader for everyone to be like, right, you are a writer, you are a writer. And that is another component of like being in the comms baddies, the love and respect that each of them has for each other. And so I'm going to step back and ask this question for you all to share, like, what are you working on that's related to the program at the moment? And LaDawn, since we just stopped with you, why don't you kick us off?
B and I can actually take shares on this. So B, you can come off and mute now. This is our time. Um, so currently at the present moment, B and I are in the process of writing an article to the Pause, I believe. Positively Aware.
Positively aware. Yes.
Positively Aware magazine, yes. Um, Stay tuned. Unless B is okay with us sharing, but we are in the midst right now of writing an article.
Bee, would you like to add to that?
Yeah, because I wrote something else, and I don't mind sharing LaDawn. So right
Okay.
now I'm working with LaDawn on an article about USCHA. I won't get into the depths of that, but what started from work during the fellowship has now grown into something much bigger, and it's creating change and how big of a change we can create when we use our voices and we reach out and we listen to others and we listen to our community members. And so much has happened during this fellowship that I think this is the boom to it. Thank you.
I love that. And Xena, please.
So as Juan Michael mentioned earlier, I just completed the PWN-USA like policy practicum fellowship. And so for my policy practicum project, I basically organized an event that will be happening this month at the end of the month on July 26th. And it's going to be a nighttime sit down sort of art festival slash free testing event. And so I've been partnering with different local organizations in New Orleans. And so some of those people are helping me with like curating the event. Some of them are helping provide resources that are going to be harm reduction resources. And we're going to be doing free entry for anyone who gets tested for HIV, syphilis, or Hep C. So we have Preston Care, who is like our primary fiscal sponsor, helping like us afford the event and all of the costs. And so I'm also going to have an hour of performances, a film screening, and I'm going to DJ at the very end. And we're hoping that this can become like a fiscally funded project that can happen regularly as a way for people to get tested outside of the clinical standard times that it's open, because it'll be happening on a Sunday night. And so that's like my project. And the fellowship has ended, but I'm still working behind the scenes with my co-organizer on that. And because I ended up doing this fellowship at the same time, it influenced how I developed the panel that we're going to be doing after the film screening, before the performances. And so we've been reaching out to different people in the community who we think would be like interested in speaking, kind of similar to what we're doing here. And we're going to be talking about like myths and dispelling myths. And that was kind of something that we were talking about at the beginning of the fellowship, was just like the inconsistencies sometimes in public health messaging, and how we were trying to confront that by bringing it to a place where it can be easily understood and digested. And so I kind of took that, and me and my co-organizer, who's going to host the event, we have been coming up with questions based around dispelling myths around HIV and AIDS, sex work, and consent. Because those are also kind of like the themes of the event, is creating like an accessible, sex positive, safe space for people to come in, get tested, have entertainment, and then honor those who passed, because we're going to open with an altar space. And so that's going to be like the culmination of my project. And I decided to like sort of use some of the lessons we were learning, and then some of the stuff I learned from LaDawn, who actually, I have to mention, said that she was not a writer at the beginning of the fellowship. And so it was my mission to get her to become a writer. And so now I'm so happy that LaDawn is a writer, because she's a great orator. And so I was like, of course you would be a good writer because you can speak so eloquently. So I'm happy that I also learned things from Bee and LaDawn and Juan Michael. And I think that that can be replicated with different groups of people. So I'm excited to see the different iterations that will happen in the future, from people to learn from each other and learn from someone like Juan Michael, who came in as someone with like a long history of writing, which I really appreciated as a creative writer. It gave me a whole new way to write. Like LaDawn was saying, not necessarily just for me, but for the general public.
Thank you for that, Xena. And I want to, you already like addressed it, but I actually want to like say like, what is, for the next question, a public health message or issue that you'd like to address? And like, what's a tool that you would use? And I mean, it could be something that you understood from the program, but just like, how would you address that issue? And like, really quickly, for everyone involved, one thing I raised up is that public health messaging is happening all the time. Even people who tell you you can use olive oil as like sunblock, they're lying, but they're also advertising. They're advertising because they want to influence you, because we're in the attention economy. We're advertising and influencing you with information to save your life. So, like, what's a public message out there, Xena, that you're like, this is one I want to address?
Actually, to borrow from LaDawn, which I've heard her say this before, but everyone is HIV possible, has just been reverberating in my mind, because I really feel like it really nails the head on just where we are in the HIV movement. Like, we have the science, we have the information, we have all these organizations on the ground mobilizing, but I do still feel like it's not entirely reaching the public, because it's like we're like here at U equals U, and the public is like still not really able to differentiate between HIV and AIDS related illnesses and or deaths. And that's just so much scientific information for people to really learn. But then we're also in a country where the average reading level is sixth grade. So it really is like a challenge in meeting people where they're at, like you said, and not leaving them there. And I think, based on what we even talked about in our conversations, U equals U, it's not that it's incorrect or wrong, but it almost already assumes people understand what being undetectable is, which I don't think people really do. As a general population who are not living with HIV, people don't understand you can live with HIV. They don't understand that it's not a death sentence anymore, because people are still in their minds in 1985. And we talked
Mm,
about even just how the CDC has only recently admitted about U equals U, even though people knew for a long time on their own. And that's something they still haven't really said anything about. So I think that's also shaped how the public perceives the information, because they trust the CDC more than they do the people who are living with it. And so I really appreciated this program, because I do think more people living with HIV who are in this work need to be publicly communicating with people who are not, so we can, do the work the CDC isn't doing, which
mm,
is educating people about how this actually works on a scientific level and not a personal social level. Because we have a lot of just personal social opinion kind of, oh, I saw this on TV or social media or a movie, and the science is kind of like, you know, in the distance. Like, it's there, but people haven't gotten it yet, because most, especially here in Louisiana, for example, sex education is essentially illegal in public schools. So even if
Xena, you have like a couple of things that I want to say that like just because we have 8 minutes left, I'm going to move. But like you already have me writing down things that I want you to write about, including how Comatose came together, so you can make it a guide for other people. That uh, Xena is also going to be leading a webinar for us later this month, just so you know. So stay tuned for information about that. Thank you. B, what's a public health message that you would like to address?
I have two, and I'll bring up forward. One is accessibility. So, very big accessibility, and then who gets to represent in the public health messaging and who gets to help create it. So, we are often part of the message, or we're talked about in the message, but we aren't part of building it. And so it's time that we start building the messages and then them being put out publicly. And accessibility can be treated in the same way, but yet it gets added later, and it's not at the forefront of what people really think or envision when we are talking about it. It's later considered. And so, using what I've learned from this program, I would start asking questions more. I would start listening to people and what they say, and how this public messaging is being harmful to them, and looking closely at the language that's being used. It's really important. And then identifying who's missing and who is that message actually reaching. So I think this public health messaging is stronger when the community is a part of creating the message from the beginning and not asking us later how we can fix the problem that we created, but rather than implement us and use us in the messaging itself.
Amen. LaDawn, same question. What's an issue you'd like to address?
I'm gonna have to go with Xena and talk about this U equals U and prep because I'm tired of it being the messaging is as if it's it is two separate things, but it's for an ultimate purpose. And the messaging just don't fit the purpose to me. Like I feel like it needs to be one big message that people can understand and actually get instead of making it seem like it's two separate things. Like U equals U and prep, it goes together. It goes together to me. So prep and U equals U.
Yeah, and I think people, Xena has spoken about this, like the lack of trust, that people will do like these false arguments or false narratives in spaces instead of engaging in the conversation that's in front of you. So like I definitely think we need more of this. And from people who are actually engaging with community, not having it be a top-down, like we are in our administration telling you how you should talk about this. Talk to people where they are in a way that's real for them. LaDawn, this next question is for you. What counted as a win for you because of this program, or what's the biggest lesson you've taken away from it?
The biggest lesson that I took away from this, our minds can go. Our minds can run over 1,000 miles an hour, right? And when we want to address things, our minds can go. This has made me actually learn how to focus my mind. Write it out, right? Write it out. Think about your plan when you're writing it out and make sure what is the impact that you actually want to make when you're writing it out. And again, our mind runs, right? So you can't focus on all these issues or all of these concerns that we all have at the same time. Take your time, be paceful, and focus on the one thing at a time, and you'll be amazed at the change that you actually can make.
Well, that's something that I shared with them all as an editor. For those who don't know, I used to run the Baddie and thebody.com, and I would often tell my writers, you have too many ideas in this, and a person can only hold one idea in their hand at a time, maybe two, but that's another article that you should be paid for. So don't put it all in, don't give it all away. Pace it out, like LaDawn said, because you deserve to be paid for every single one of those ideas. Thank you. B, how did you decide what track to focus on during the program? And very quickly, there are 3 tracks, by the way. There's the public speaking track For those who want to be in person, focusing on that, there is the social media track. For those who want to do more like creating assets or influence or speaking to the camera type. And then there's the journalist track, which is what Bee chose. And that's more reporting, studying, and Bee, please.
So I was really undecided between, I think, track two and three, until I had a conversation with Juan Michael, and he helped me better understand where I would fit best. And that was really helpful, because when I talked to you about that conversation, you were like, you should just write then. And I was like, that's great, because I do enjoy writing, absolutely. And writing can be healthy, and it can be rewarding, and it can also be healing. And it can also be healing and rewarding for other people as well. And so for me, writing implements a different message versus doing the social media track or doing the other track. And so for me, people perceive the messages in writing differently. They have the option to always come back to that, and they can insert themselves in that as if they're reading a book. And to me, that's important. Sometimes we don't always get the message through a video, and sometimes we don't always get the message through a short that's being out there. And so for me, writing can be very, very powerful. And that's what set with me. I think really being able to write. And it really helped me realize that writing was the right focus for me. And I will say that once we see what we see, we can't unsee it. And once we hear and we can't unhear it. And once we know, we know.
You cannot unknow it.
Yes.
Bars. Thank you. Xeena, you are our final question before our Q&A. Was there a topic that you had a break on during the program, or is there anything you saw in a new light because of your time in the program?
I think the thing that I see in the newest light is, I guess, just thinking about writing as a tool to reach people as opposed to express yourself. Like, I don't think one is better than the other, but coming from a creative writing background and like in a background as an artist, I was never necessarily always super concerned with like reaching the public as much as possible, because when you're working in the creative field, it's more just about like experimentation and play and seeing what happens, and you're not necessarily always the most concerned with the outcome. And so I felt like this was a good challenge for me to bring my creativity into a defined skill set, kind of like LaDawn was saying, just learning how to focus on one thing and not multitasking like different ideas. And honestly, that really helped me simplify what the panel for the event was going to be, because at one point I couldn't really decide like what should the panel be on. This event is addressing so many different things. And so because I was doing this fellowship at the same time while I've been meeting with my co-organizer planning the event, we just naturally were able to figure it out a lot more easier. And so I feel like doing this fellowship has also kind of brought me back to something I know, but I'm exploring again, which is just simplicity. Less is more, and like making things digestible, not just on page or speaking, but just in life. And so I think this can be a resource for anyone. And I chose social media, I think, because that's where I live as a disabled Black trans artist who is mostly homebound. I utilize social media as a leverage to be able to reach people I can't physically reach. So when I saw this, I was like, this would be a great place to bring public health into social media where a lot of people are. So I'm excited to see what comes with the future.
I am too, and especially because there's so many things that you all have created that we're going to. I was working on the PWN birthday party while doing this fellowship, and like they were so amazing. There was one day when I was in DC, I was walking, nearly got hit by a car while doing the fellowship with them, and just like turned it into a lesson about like, this is an article. The headline is, has DC become more dangerous since this president took over? Let's look at the figures and discuss. And like, like I just want to say like that was the joy of working with them when they talk about simplifying things. You take one issue and you turn it into an article, and then there's another touches on, and that's another article. But like here, this is the Q&A time. If you have a question or you would like to make a comment or ask anything of any of us, please raise your hand and we'll invite you on. Don't be shy. And we can also continue our conversation in this format. Oh, here's our first question. Melanie, please.
I have a comment, not so much a question right now. When LaDawn was talking about how U equals U and prep are the same thing, and she doesn't know why it's not treated that way, that is by design. It is by design because prep and everything that goes with prep, the marketing, the advertising, the cost of the drug, and all is in one pot over here. And then the U equals U is treatment, care, adherence. That's in a different pot. Now, at one time, they were thinking about putting all the money in one pot. But those who were in treatment and care were concerned that how would it be equitably divided so that we who are living with HIV, you get access to all the medications and services and everything that we need. And as we are living with HIV, we don't want that to happen to anyone else. So there was this big controversy, and so it stayed two separate pots. So that's why it's not together. Not that it couldn't come together, because the systems and structures that are in place now are not people friendly. They are not humane, and we have to build a new infrastructure and a foundation on humanity. And then
You said it.
that could make that a reality. The care and prevention, treatment, all in one pot, because we're all human beings and we all need to live at our highest potential and with the most, the highest level of quality of life. And we have to all get along.
LaDawn, you look like you want to like share too, please.
Melanie, you're right on that. But now times have changed, right? So what I would love to be able to see is me in a commercial with my partner that's on prep, you know, and we're walking down the street and we're going on a date. And then at the end of it, we're going into the bedroom because we know we can't transmit. That's what I mean. Not the funding source. I know that'll never work. Well, it can, but no. I was talking about like visual wise, like we're trying to end the epidemic, as they say, right? So quit treating, far as commercial visuality, quit treating this like it's two separate things. It's all to end the epidemic. U equals you, again, if I cannot transmit and then my partner is on prep, the messaging is something completely different then.
Yeah, and I love both of these. What I was thinking, Melanie, when you were speaking was I didn't know that history around the like refusal to combine them and why. And I was actually thinking that would be a really wonderful article to read. And I mean, like Comms Baddies or whoever, or Melanie, if you're applying to be a Comms Baddie, I'm just like saying someone needs to get on that. And LaDawn, just like that whole perspective right there around that commercial. Did you share that during the fellowship? I was like, this sounds familiar and it's coming back to me. And I'm like, this needs to be something that we see. This should be pitched to Vive and they should be paying you for it. Don't steal no ideas. But like that clarity is so so beautiful. And what I love about, thank you both for that, showing that clear line in real time around the public health messaging about why something isn't combined and about how it's not even about the funding cycle as it is about people taking ownership of their own health. Because yes, you can't transmit, but why should the onus be on the person living with? Um, Lots of ideas. Anyway, getting back to
Thanks
the
for that
Q&A.
history, Melanie. Thank you.
Yes. Any other questions for anyone about the program or for any of the participants? And again, not going to bully you because I can go back into asking questions of folks on here because I love listening to them speak. Well, let me go ahead and do that. Um,
I was going to ask a
please,
question.
please.
When is the application going to be open? And do you have an idea of the length of the cohort since this was just a pilot and it was short? Because there was some very rich um, ideas and the camaraderie, the togetherness of these three in that short cohort. I can only imagine if it's longer and there's more people involved, how uh, phenomenal that would be. Having you have three who are doing their thing. Just imagine add more people to that doing their thing, and um, they were talking about change. Well, I'm still waiting for change because I want to see big change, not little incremental changes. And we can do more change with more people who are like-minded and who are learning the same principles and getting the tools in order to do that.
Thank you. So applications actually opened last month, and they're open until July 27th. So these four questions, it's only four questions in the entire application. Your name and location, where you are geographically, what public health means to you, how you wish a public health issue had been explained to you, and why you want to participate in this fellowship. And I want to say this, if you have never written before, that's fine. If you feel like, well, I'm not the best writer, I'd rather speak it out and send it as an audio file, that's fine. I believe that insisting that things be transmitted only through writing is white supremacy. And it is harmful because I have friends who are brilliant, but they tell me, I see you sent me this article that you wrote. If you don't send it to me as a like written piece, I'm never going to, or a oral piece, I'm never going to hear it. And so I've actually been recording myself reading articles to my friends just so they could get the information. And I opened that up to everyone else as well. The questions are very simple as well, because I actually want to hear from you about who you are, not who you think you're supposed to be. The public health messaging that exists fails. They spend millions of dollars on these things to say 2 + 2 is 4, and people still are coming out with 5, 6, and 7 because they're not actually being addressed. I'm not asking for people who are experts to be in here. I'm asking for you to be you. And I will add that LaDawn, Bee, and Xeena, I asked them to be in the pilot because they were amazing. I'd seen what they'd done, but they were all very different. Very, very, very different. And to Melanie's point, the camaraderie that they have was developed by them and their eagerness to learn and participate and like to help. As to the length of the program, this pilot ran for 2 months. The actual next cohort will run for 6 months. So it'll start in September and then run all the way through to the end of, I believe that would be February, the end of February. Can I count? Nope. Wait. See, I'm embarrassed because I'm doing this in live. October, November, December, January, February, March. So the end of March for the first cohorts. And I want to add that there are times when I came into a lesson with a lesson plan, but we threw it out because of what the comms baddies needed and what we were talking about in that moment. And so as a former full-time educator, I believe in a constructivist classroom that is led by the people who are in the room. And whoever applies, whoever is brought in to work as a cohort, ultimately, it doesn't matter like what the lessons I want to focus on are. It matters who's there in that moment in time. And we will actually teach to where they are as opposed to me dictating what I think they should say. For sure, there's going to be a lot of experience with like a lot of different material that we've done. Like what does it mean to be on social media if you don't like social media? What does it mean to write if you think you're not a writer, but you actually are a writer? What does it mean to speak in person if you feel like a little nervous about that and like how to actually cope with that and get that across? And I'm going to stop talking right now, just so that we can get back to the Q&A. But I want you to know that like I have designed applications for over a decade to dance concerts that I used to produce. And there were only 10 questions. One of the questions was, what's your name? What's the name of your dance company was another one. The truth is, most applications that are out there are scams, and they're asking you things that no one bothers to read. This is simple. This is focus. All I'm asking you to bring is you. That's it. Yes. Any other questions? Or follow up
Comment.
even with that? Please,
Comment. So
please.
I'm a little bit jealous because they get 6 months.
I've seen your facial expressions, LaDawn. I've seen them. I know it.
Like, wait a minute, y'all. No, literally, look. So the reason I'm a little jealous because you all didn't get a chance to do this pilot, right? But you all get to get 6 months of great inspiration, great information, and learning something about yourself that you didn't even know about yourself. Man, that's bold. Can I come back? Like,
I almost just said that. I was
I
like, can we get a second opportunity?
All of you
I
guys were teaching it
6
together.
months.
oh no.
I didn't know it was
6
just Juan Michael. I
months.
thought there was a whole plethora of leaders.
Good to yes.
6 months.
Well, that's the policy one. We had a whole bunch of leaders. We had a whole gaggle of them. So I thought that maybe Juan Michael had a gaggle of you.
No. I am such a benevolent dictatorship type of person who follows the will of the people in the room. And I'm like, I don't want to hear your opinion on that. I want to hear their opinion. And it's funny because I have been a part of fellowships where I led for 3 weeks and then another person led for 3 weeks. And like that works beautifully as well. Public health, ooh, I'm gonna get in trouble. I don't respect most public health messengers. I think they're dumb. I think they're obtuse. I don't think that they as individuals are dumb. I think the work that they do is dumb. And there are times when I'm speaking to people who I'm like, oh, I know how smart you are, but you're talking about this thing in a way that doesn't make any sense. Like, I've had someone say to me, if we give kids condoms, they'll have sex. And I was like, the kids are having sex just like you were. Like, or oh, if we get them prep, they're going to be risky and dangerous. I'm like, or they'll do a risk assessment and be involved in care, and will actually, if they acquire an STI, will know it sooner than they would have. Because guess what? They're going to be out there having sex no matter what. Um, Sorry to go on a whole tangent there, but that does answer your question about I am the sole session leader during the program. And one reason why is, like I said, benevolent dictatorship that follows the people who are involved. Another is the scheduling of it all. I have been in spaces where we've had a session leader who had to cancel at the last minute, and it's so stressful. It's one thing for me to make up time with someone who missed a session. It's another thing when it's like a whole cohort session has to be made up for because someone failed, and I'm just never going to be in that position where that happens. I want to add that PWN's comms assistant is the administrator, Alex. Alex is incredible and really kept everything on point, and I'm so excited to partner with them on this and to see their leadership take platform as well. And I also want to add that so some of the projects that we do involve not only understanding pitching, but actually pitching articles that will be published, creating social media assets, but also podcasting, also hosting webinars. And so Xeena is going to be hosting a webinar for us soon. And that is about U equals U messaging. And Xena's now just hearing this in real time. Xena, let's push it to the first week of August so that we're not like rushing to get to it, just so that we both have time. And Xena, will you come
I
off,
thought it
please?
was in August.
You know what? It is.
Yeah, I think we did settle for August because we had this conversation in the past.
Good.
I think
I
we
think
can
so
we,
too.
we can circle back around to that before the end of the night, just so we can both go to bed knowing we're
It's
giving
in
ourselves the
August.
right amount of time. Wait, am I supposed to be answering a question?
Well, I actually have a question for you that I want you to answer.
Okay.
Um, you spoke about differentiating between being a creative artist and like sharing public health messaging that meets people where they are. And can you speak about how Comatose actually combines the two so that like you get to have the artistic and you get to have like the actual messaging that's there so that a wider array of people can be like, oh, I get it.
Okay, so just to give some background, my name is Xena. I am also known as Kool-Aid DJ, which is like Kool-Aid but with ghoul. And I started DJing in 2016 in New Orleans. I always wanted to be a DJ growing up because of Keith Sweat Hotel radio station. And so I have a history of being in nightlife for the last like 10 years. And I also became disabled in 2021 following a car accident. And so I always wanted to do a party that would have testing because that's something I saw happening in New Orleans at different events. And I had been a part of like this Council for Alcohol and Drugs and Addiction New Orleans, like um I was like a youth advocate, and so there was a program that I helped design graphic design materials and test and helping youth get tested, and we would compensate them. And so that was like my first HIV and AIDS like position. And I also did the like CDC community promise training there, as well as the like AIDS Regional Planning Council peer advocate training. And I had basically been going to a clinic that is also literally my fiscal sponsor at this moment for the event. And that's how I knew to reach out to them because I used to attend the clinic and I used to be a part of their HIV support group. And then as I transitioned, I kind of stopped going because it was mostly a space for gay Black men. And I just didn't necessarily want to be there as much anymore. And so eventually as I came to terms with also being disabled, I started going to PWN chapter meetings and I started getting more involved. And eventually I applied for the policy fellowship. And I was like, what do I want to do for this? And I decided, okay, I've always wanted to do an event. So how can I do an event that is accessible, that pushes forth some kind of resources, creates like opportunities for people to learn? And so I've been partnering with just different people that I've been working with already. Like there's a oral history nonprofit, and we do interviews with different elders in the city. It started out as a documentation of the last existing lesbian bar in New Orleans, and now it's sort of expanded to just interviewing different LGBTQ elders. And this year, or like last year, we focused on Black trans people who are elders, and we created like a play based on those interviews. And now I'm actually working with them in transcribing and doing podcasts. So that was kind of like another way, like doing the fellowship prepared me to do what I've done now. I've also done a lot of phone banking with PWN. And so I was doing the phone banking and the play at the same time while I was also doing the fellowship. So all of those things kind of bounced off of each other. And the skills I was learning in the fellowship, in doing the phone banking and acting. And so I wanted to do something that sort of like brought all of those things together that I was already diving into. And in the past, I've also been a like, what is it called? The Community Advisory Board. So I've done that for Crescent Care, and I've also done that for this other organization called Tulane NOLA Hype. And they work with people living with HIV who are 16 and older. I think it caps to like 25 or 26, but they focus on people who are younger. So I worked with them for a while, and they used to do events in the city where they would have testing for youth and people under 18 and have like drag shows and balls and bring out performers and things. And so I had went to those in the past, tabling with Kada, where I did the youth like advocacy work, like trying to help youth get tested by compensating them. And so I have had like different experiences over the years that I tried to bring together. And so I thought it would be a cool idea to have an event that people could sit down, eat, get tested, listen to music. So we're gonna have like a film screening, a panel, an hour of live performances. So there's gonna be some drag, some comedy, some poetry. And I want this to be like an ongoing thing that eventually develops into including a place for people to learn how to DJ, and then also a peer support group for kind of the same demographic that PWN serves, but specifically for people in New Orleans, since the PWN LA chapter is like mostly in Baton Rouge. And then hopefully that could expand to like New Orleans having its own chapter. So those are like some of the things that I'm planting seeds for with the Policy Practicum Project. And so I took it as a time to just, you know, what are the things that I'm dreaming of doing and move forward with that. And so I was successful in being able to get support from different orgs like the Oral History Project, Crescent Care, Odyssey House. They're going to provide harm reduction and free testing as well in a mobile unit. So that way there's also like an option for people to get tested if they like don't necessarily want to go to the event or, you know, go inside, or if they are just like walking on the street and they're like, what's that? And so we're going to have that as well. And so I'm just feeling happy and successful that I was able to do this actually. And
All
also,
at once.
yeah.
And I want to note that, like, it sounds like listening to you, I see the vision so clearly, and I see the intention and the steps one by one that are actually building towards a chapter. And like, I hope that you reach out to some of the people here at PWN, like Wahida, who have like that history of starting chapters, so that like they can just give you their own perspective of what like worked, what didn't work, just so that you have it in the back of your pocket. And that can also help with like the oral history project that you're doing, because we need our voices recorded.
Yeah, I
Uh,
just wanted to add,
Please.
just to speak to that piece. So we're actually going to be working with a friend of mine who is a filmmaker
Hmm.
and does film. And so we're going to be paying them to document the entire event. So that way we can keep in like archive of the performances and the panel and like just people being in the space. And I'm hoping that like in the future, I'll be able to like show people the whole process of like me at the graduation and then the event, and then just like maybe, you know, some of me talking, and I can share that with people as a way to replicate in their own city, and even maybe like going to other cities and helping them create like it, and we would go to those places and help them start it. So that's kind of like what I'm hoping I can do as well.
Nice. I want to add that something. So even though this was a pilot, I'm committed to continuing to work with our comms baddies here on their individual projects, and it's not just like one and done. So like, and yes, LaDawn, like tweeting, like re-upping, so proud of you, Xena. I wonder, LaDawn, can you speak about a project that you'd started with your HRSA grant before you even came into the comms baddies, just to share that with people? And this is another example of something that I think needs to be written up. Please, LaDawn.
Come on, how I created a seat at the table, and we got our housing project. So, really, when the EHE funding was let go, unfortunately, we wasn't really thought about. When I say we, I was talking about women. we wasn't really thought about. And I love my sisters, brothers. I love them all. So I cool everyone. But I want to know what was going to be for me. I'm a heterosexual Black woman that's living with HIV, and they wasn't thinking about me at all in this process. So I found out where this meeting was and pulled my own chair to this meeting. If you can't be invited to the table, bring your own chair. Bring your own chair. And we talked about, we started talking about, yes, now we got everyone at the table. Let's have a real conversation on what we're going to do with this funding. And thank goodness the Ryan White Part D actually got their housing project.
Amazing. And I think that we're going to have to see that in a workshop at USCHA next year, right? I have a
Okay.
feeling it's going to be there, right?
Yes, they do plan to submit next year to talk about all of the late nights, all of the phone calls, all of the meetings we had to come up with the grant because some of us did not know how to write a grant. So we had to go through some capacity building on our own. We had to do our own needs assessment. We had to do our own transcribing. Xena, I know about that transcribing. We had to do our own transcribing of the data that we collected. So yeah, it was a lot of work.
What's amazing is that you came in, both you and Xena and Bee came in with this strong like backing to do this work. And even as you had to do all of these things on your own, you did them. To the point that the government was like, "Oh, here, take some money. Take our money. You need this is we can't say no."
Yes.
Wonderful. And B, my final question. Now that you have all of these tools in your hand, how are you going to use them to expand offerings to other people who you know out there need these opportunities as well, but maybe who don't see it for themselves? And I know this is a sudden question, B, but like, please.
Um, yeah, so that's for me, if somebody reached out and said like, "Hey, I seen you were on a Comms Baddie. I don't feel confident enough that I can even fill out the application." I would first and foremost tell them like, you don't have to have experience in any of this. I think that was the biggest thing that I did take away, even as someone who has written in the past and who will continue to write. I don't consider myself as a professional writer, and none of us should feel like we have to be a professional writer to join the Comms Baddy program. And I appreciate you saying that, because anybody who would come to me and said like, "Hey," I would tell them the same thing. Like, let's start here. Do you have an idea? Let's run with this idea. What is the one message that you want to get across to people? And that is the biggest thing that I can take away, is to really hone in on that one message, because there are so many messages that we can have within one article, within one video, within one social media post. But it is really making sure that we have that one message, and what do you want the audience to really get out of it, and really guide somebody through that process the same way that you've guided us.
Amen. Thank you. And I should note you are a professional writer. You're about to be published and paid. So thank you, everyone, for attending Who Wants to Be a Comms Baddie? And thank you to our panelists for sharing their experiences and wisdom. Each cohort has a different experience that's driven by the participants. Bee, LaDawn, and Xena were invited based on their wisdom and breadth of work. Please don't feel like you need to come in knowing everything about public health and communications already. The program is designed to teach you and empower you. Thank you, Bee, LaDawn, and Xena. Good night, everyone.
Thank you, Juan, and good night, everyone.
Thank you, everyone, for joining. Good night.
Good night.
Thank y'all for joining. See you later.
Bye.